Yeah, so that's also a great question. It comes up not infrequently. So I would say, in general, most patients, in my experience, in my practice, are not candidates for non-surgical or otherwise known as liquid rhinoplasty. The reason is when you're doing non-surgical or liquid rhinoplasty, you're really not making the nose smaller. We are adding volume to the nose to kind of change the shape, and sometimes it's useful if you're trying to hide a bump or correct a minor asymmetry, or if someone's got a very low bridge, for example, in ethnic populations, we want to raise the bridge or augment the nose in a certain way, then I think it has a role. But the vast majority of patients have noses, especially in the female population, that are too large and they want them smaller. So that there's a limited role for non-surgical in my practice. I also think sometimes in certain patients who have had revisions elsewhere and don't want to have another operation, it plays a role in kind of correcting minor deformities and minor irregularities. However, it should be done by an expert. I would say this in anyone that's getting non-surgical or surgical rhinoplasty, but especially in non-surgical rhinoplasty, you really want someone who's an expert in the nasal anatomy and in my opinion, should be a surgeon who's operated on the nose. So we really know the anatomy very intimately and can be safe because it is a slightly higher risk area in terms of injectables.